Hello and welcome to GP Notebook TV. I'm Dr. Anish Kotecha, a GP in South Wales. Today, I thought we'd discuss an important meta-analysis published in Diabetes, Obesity and Metabolism in 2024 that focuses upon intermittent fasting in adults with prediabetes or type 2 diabetes. Now, as we know, diabetes and prediabetes are major global health concerns with increasing prevalence as well as associated cardiovascular risks. Now, while lifestyle interventions are our first line strategy, finding effective and sustainable dietary approaches can be challenging. Now, this meta-analysis sheds light on the potential of intermittent fasting as a dietary intervention. The study analysed 14 randomised control trials, including over 1,000 adults with prediabetes or type 2 diabetes, and it compared various forms of intermittent fasting such as time-restricted eating and alternate day fasting with controlled diets and calorie restriction. Now, intervention durations range from around 2 weeks to 12 months. Now, before we discuss the finer details, let's sort of set the stage and remind ourselves of the critical and clinical context surrounding diabetes as well as prediabetes. Now, as we're all aware, diabetes and prediabetes have become major global health challenges, as mentioned earlier, and their prevalence continues to rise, bringing with it increased risks of cardiovascular diseases as well as all-cause mortality. To put this into some perspective, as of 2013, the prevalence rate of type 2 diabetes was at least 6% and accounts for a staggering 10% of NHS expenditure. Just to refresh our memories, type 2 diabetes is determined by a fasting blood glucose above 7 millimoles per litre or a random glucose level exceeding 11.1 millimoles per litre. And pre-diabetes, which is that crucial warning stage, is characterised by a fasting glucose of between 6.1 and 6.9 millimoles per litre or a random glucose of 7.8 and 11 millimoles per litre. Now, at its core, type 2 diabetes results from a progressive loss of insulin secretion following the development of insulin resistance. And as primary care physicians, we're on the front lines of managing this condition, often starting with lifestyle interventions before or alongside pharmacological treatments. Dietary therapy remains the cornerstone or a cornerstone of our non-pharmacological approach. It's worth noting that the typical British diet often lacks essential nutrients such as fibre, potassium, magnesium, folate, antioxidants, as well as anti-inflammatory compounds. And this is where our interventions can make a significant difference. Traditionally, we've relied heavily on calorie restriction, typically reducing daily energy intake by 20% to 50%. And this approach has improved glycemic control, insulin sensitivity, as well as cardiovascular markers. Specifically, calorie restriction has been shown to improve myocardial function, reduce hepatic fat content, as well as decrease oxidative stress, and enhance lipid profiles. However, we've all faced the challenges of poor long-term adherence to these quite restrictive diets. Now, intermittent fasting has really gained popularity as a potentially more flexible strategy. It comes in various forms, including alternate day fasting, which is 0 to 500 kilocalories on fasting days and eating freely on your feeding days. The 5-2 diet, which is 2 days of fasting with 5 days of feeding, and time-restricted eating, which is eating during a period of 6 to 8 hours and fasting for the remaining hours each day. Intermittent fasting may improve insulin sensitivity, enhance beta cell function, and increase glucose tolerance and fatty acid oxidation, as well as improving postprandial glucose levels. However, we do know that more research is needed to really understand these mechanisms fully. Previous research has suggested that intermittent fasting can be effective for weight loss and may actually improve cardiometabolic markers such as lipid profiles and glycemic control. In fact, some studies have actually estimated that shifting to a predominantly plant-based diet, which does often align with intermittent fasting principles, could potentially prevent millions of deaths annually from diet-related illnesses. However, the evidence specifically for patients with type 2 diabetes has been limited and sometimes conflicting, particularly regarding glycemic control. And there are also concerns about potential deficiencies in protein, iron, vitamin B12, omega-3 fatty acids, calcium and iodine, which really must be carefully considered when implementing intermittent fasting. Now, this brings us to the importance of the study we are discussing today. Now, despite the growing interest in intermittent fasting, we've lacked more robust evidence from large-scale analyses, especially for our patients with prediabetes and type 2 diabetes. The meta-analysis we're about to explore aims to fill this gap, providing us with a more comprehensive understanding of really how intermittent fasting might fit into our treatment strategies. So let's break down the key findings from this meta-analysis. Compared to control diets, intermittent fasting significantly benefits body composition and glycemic control. Participants lost an average of just below 5 kilograms in body weight, which is substantially more than the less than 2 kilograms reported in previous studies, reducing their BMI by nearly 2 kilograms per meter squared. Now, this larger effect could of course be due to participant characteristics and study design differences, but it's certainly encouraging. Importantly, HbA1c decreased by 0.81% and fasting glucose by 0.36 millimoles per litre. Now, these are clinically significant improvements that really could have meaningful impact in our patients' health. The lipid profile also showed modest improvements, where total cholesterol decreased by 0.31 millimoles per litre and triglycerides by 0.14 millimoles per litre. However, there were no significant effects on either LDL or HDL, and blood pressure also showed no significant changes. Now, when comparing intermittent fasting to more traditional calorie restriction, they found intermittent fasting to be more effective for weight loss, as well as BMI reduction. However, it is crucial to note that intermittent fasting didn't really show superior benefits in reducing fat mass and improving glycemic markers, lipid profiles, or blood pressure compared to calorie restriction. Now, this suggests that while intermittent fasting might be a more efficient tool for weight management, it may not offer additional benefits in other areas of metabolic health. It's important also to note that subgroup analyses revealed some interesting points. Time-restricted eating, where patients limit their daily eating window, was effective for weight loss, reducing body weight by over 3 kilograms. Other intermittent fasting modes showed even greater effects, with an average weight loss of over 6 kilograms. When they looked at time-restricted eating data alone, there was no significant effect on HbA1c, suggesting that other intermittent fasting approaches like alternate day fasting or the 5-2 diet might be more effective for glycemic control. So, most importantly, what does this really mean for our practice? Well, firstly, we now have evidence that intermittent fasting can be an effective strategy for weight loss and glycemic control in our patients with prediabetes and type 2 diabetes. This gives us another tool in our dietary intervention toolkit. Secondly, intermittent fasting improved fasting glucose and HbA1c compared to controlled diets, but not when compared to calorie restriction. Interestingly, the improvements in HbA1c were more pronounced in type 2 diabetes patients compared to those with prediabetes. And this suggests that intermittent fasting might be particularly beneficial for our type 2 diabetic population with more severe glycemic dysregulation. Now, these benefits were seen in both short-term and longer-term interventions up to 6 months. Thirdly, while the effects on lipid profiles and blood pressure were minimal, the weight loss achieved could indirectly, of course, benefit these parameters over time. But we must consider some important points when implementing intermittent fasting. The variety of intermittent fasting protocols used in these studies does make it challenging to recommend one specific approach. We may need to work with our patients to find the most suitable and sustainable method for them. On a practical note, intermittent fasting might be more sustainable for some patients than continuous calorie restriction. To support patients in adopting healthier eating habits, we can suggest some practical tips like cooking from scratch, bulk buying ingredients, using frozen and tinned produce, as well as batch cooking to help manage food costs. While intermittent fasting appears safe in the short term, we do need to be cautious about long-term adherence and potential risks, especially in patients on insulin or those at risk of course, hypoglycemia. Now, these considerations should be factored into our decision making when recommending intermittent fasting. And individualization is really key. What works for one patient may not suit another. So we must consider each patient's specific circumstances, preferences, as well as health status. Regular monitoring will be crucial, particularly in the initial stages of implementing an intermittent fasting regimen. Now, in conclusion, while intermittent fasting shows promise as a dietary intervention for prediabetes as well as type 2 diabetes, its implementation should be carefully considered and monitored. The choice between intermittent fasting and other dietary strategies should be based on individual patient factors, preferences, and the ability to adhere to the regimen longer term. We should always combine dietary interventions with other lifestyle modifications and appropriate medical management. This study, however, does provide really valuable insights and highlights the need for further research, particularly on longer-term effects and optimal intermittent fasting protocols. As GPs, we are really well positioned to contribute to this growing body of knowledge through really careful observation as well as documentation of our patients' experiences with intermittent fasting. Thank you for watching this GP Notebook TV update. Stay informed, stay critical, and keep making a difference in your patients' lives. Goodbye for now.